thank you for attending the online training on the nutrition module for CowManager. My name is Ben Nottage. I work full-time in the UK with my colleague Christo. We're both dedicated solely to CowManager, the sales, the installation and the backup support of it. Some of you have already been using the CowManager module for a little while now. For others of you, you're still fairly new to it. So we thought we'd try and collar our in-house vet, Mr. Peter Hutt, to come and be able to give you a little bit of training on the module, how to get everything out of it and use it to its full extent. As we go through, please feel free to ask any questions, pop them in the chat, and then if we're still on that slide, we can ask them there and then. If we've moved on from that, then we can cover off any more questions that are at the end. So as I said, Mr. Peter Hutt is our in-house veterinarian, works for CowManager. So I am very pleased to be able to pass you over to Peter.
Thank you, Ben. Good evening, everyone. I'm not sure why it looks like I'm hiding in the bookshelf, but I am. So tonight I will present about our nutrition module and how you can use it on your farm. Ben, you can still see my pointer? Yeah, good. Thank you. So and how you can use the nutrition module to its full extent on your farm. But first, to start with, of course, next to our nutrition module, we've got our fertility module and we've got a health module. Those both are quite straightforward. So those of you working already with the nutrition module would probably recognize that the nutrition module is a bit more complicated and a bit more going into in depth in what's happening on your farm. The fertility module and the health module, they tell you what's happening right now, and the nutrition module tells you why it's happening. So first of all, this is the full extent of our nutrition module. It consists of individual cow transition alerts. We've got group alerts, and we've got a group monitor functionality. And the group monitor functionality consists of what happens within a group or what happens in a location. You can compare groups, you can compare locations, but you can also compare and monitor non-existing physical groups. So let's say you want to see what the difference is between parity 2 and parity 3 animals, which are maybe all together in one group. You can still see what the difference is, for instance, around calving or around dry off or even within time. And also in the group monitor, there's a dry off and calving behavior of the herd or of a specific group. And together, especially this one together, combined with the transition alerts, gives you the opportunity to pinpoint per farm, pinpoint where your transition issues actually start. And why is that? And why did we create these transition alerts? That's actually because of so since the 1970s, we know that 75% of all cows that get sick in the first 30 days after calving. And quite recently, last year, a new paper was published and they show the same results. So despite all efforts that have been done, especially focused on feeding cows and changing the feed in the transition period, focusing on, for instance, negative DCAT rations, that has improved a lot, but it hasn't improved transition diseases after calving. We also know from literature that a lot of these cows that get sick after calving already present different kind of behavior before calving compared to the healthy ones. And what you can see is that especially eating time and rumination time are already showing a decline before calving in those cows that get sick in the first 30 days after calving. We did a analysis all over the world of all CowManager cow and we saw that over 85% of all those transition alert cows got sick in the first 30 days after calving. So the accuracy is actually quite high and very trustworthy, but there is a huge difference in per farm, and that doesn't say that on farm A it works better than on farm B, but that's why you should use it in combination with that behavior around event graphs I'll show you later on, because in that case you can really pinpoint on per farm on whether your issues already initiate before calving, or if most issues when most issues occur after calving. And with those two combined, because it's cows can still get sick after calving without displaying deviation of behavior before calving, and I'll give some examples of that later on this in this presentation. What's quite important is to also, and I'll give some tools in this presentation, but it's also important to sit with your own veterinarian to discuss what to do with these transition alerts. Also look at those behavior around event graphs together with your veterinarian, but also with your feed advisor to see what's going on and what you can do to be able to improve your transition period and decrease the amount of transition disease cows. It is really possible. We've seen beautiful examples in the UK in the last couple of weeks with already well-managed farms, but within just a couple of months with over 10% less transition disease after calving by just using those transition alerts to intervene in an early moment and in an early stage. And that's the most important part of the presentation, and the rest will follow automatically. So first of all, how does such a transition disease or transition alert cow look like? So this is a graph of the transition period with here this vertical black line that shows the day of calving. And you can see here this brown, solid brown line, that's the eating and rumination time combined of the group or the herd where this individual cow is in. And there's also a beige part around that brown line, and that's the standard deviation of the eating and rumination time of the group. So this altogether clarifies most of the group pattern of eating and rumination time of this entire period around calving. So it starts, those transition alerts, they are already switched on from 50 days before the expected calving date. And they remain at risk until day 30 after calving. You can also see this solid black line, which is the eating and rumination of the individual cow. So what happens, and it's a bit simplified, the exact algorithm is a bit more complicated than how I explain it, but the way I explain it is the only way I understand it myself. So that two things need to happen at the same time. First of all, this individual cow needs to have a decline in her own eating and rumination time, plus she needs to get below the lower standard deviation of the group. And when those two happen on the same time or on the same day at the same moment, a transition alert is being generated. What's also important, so individual cow behavior, you can see this cow is going up and down where the group is much more stable. That's normal. Even if this cow wasn't sick after calving, an individual cow always goes a bit up and down, never has the exact same eating and rumination minutes per day. So individual cow behavior is always a bit wobbly. But you can see that if you would draw a average line through this black line of this individual cow, you can see, if you follow my pointer, you can see that that line declines much more rapidly than what the group does. So what this group does is actually normal, physiological, and what the group does here, it is a decline, let's say, from 3 weeks before calving in eating and rumination time together, mostly determined by a decline in eating time, and that's because in those last couple of weeks before calving, the calf grows even more rapidly, and that goes because the abdomen is already distended, cannot extend even more. So that goes at costs of the internal space in the abdomen, which is for most part ruminal space, so they can eat less. So it's normal that on a group level, eating time and also rumination time eventually will drop those last 3 weeks before calving. You can see that this cow is going down much more rapidly, especially around the moment of calving. And what actually happened with this cow is she went down with a milk fever straight after calving. That was treated accordingly. She got an IV treatment. She got a oral treatment with calcium. So that's all perfectly done according to the most recent insights. You can see that she inclined in her eating and rumination time, so she was back on track again within, let's say, 10 days. So treatment of hypocalcemia in this case was very successful. But because all these transition diseases, so from a cow's point of view, it actually doesn't matter what kind of transition disease you have. From a treatment point of view, of course it matters a lot, because the therapy differs between, for instance, an abomasal displacement or a hypocalcemia. But from a cow's perspective, it actually doesn't matter. It just shows you that her transition period was just off. What we also know from recent literature is that these transition diseases are not solitary diseases. So it's not just a milk fever. It's not just a abomasal displacement. It's not just that metritis. All those transition diseases, they are related, highly associated with each other, intertwined, so to say, which start off with, and it's also a timeline which they follow. So it starts with mostly a subclinical hypocalcemia. So they are affected by hypocalcemia, but we can see it. That increases the odds for retained placentas. That increases the odds for metritis. That increases the odds for ketosis. That increases the odds for abomasal displacements to the left or to the right, and that increases the odds eventually also for mastitis. From that point of view, it's of course very important to have a good follow-up of a treatment, in this case of a hypocalcemic cow, which was successful. But despite a solid and proper treatment, she is still, and no matter how, so to state it more black and white, no matter how good you are in treating hypocalcemic cows, they are still at risk to develop other transition diseases as well. It makes no difference if you do nothing or if you use the best treatment. They are at risk to also have retained placentas, have metritis, have ketosis, have abomasal displacement. So what happened with this cow as well? On day 24 after calving, she had an abomasal displacement to the left, and you can see it was surgically corrected, so she bounces back straight away. So that were 2 treatments that could have been prevented by intervening already at day 30 before calving. But you can also see both treatments were successful, but despite successful treatment, this cow will never reach the peak milk production she would have reached without these 2 diseases. She also won't reach the milk production persistency she would have reached without these transition diseases, and she won't reach the fertility successes she would have reached without these transition diseases. So despite treatment and despite how good we are in treating sick cows after calving, they won't reach the milk production they could have reached, and they won't reach their fertility results they could have reached. So taking us back towards that transition alert of the first time, let's say day 30 before calving. So what happened with such a cow? We need to look and see and study what's wrong with such a cow. And I'll give a few examples in the next couple of slides what could be wrong with such an animal, but it's also very important to recognize that when we vets, we dairy farmers, we advisors in this dairy industry, when we look at, especially in these days, when we look at sick cows, and when we're used to look at sick cows, we are, because of that same percentage of 75% that get sick in the first 30 days after calving, we're used to see cows with metritis. We're used to see cows with abomasal displacements. We're used to see cows with transition diseases. So we use a pair of glasses to look in a way at cows that almost automatically points us in the direction of transition diseases. We won't see any of those at 30 days of before calving. We won't see an abomasal displacement. Well, of course, there are some exceptions, but we won't see metritis. We won't see retained placentas. Those are not the diseases we look for. So we need to look with a different type of glasses. We need to look at those cows differently, and more importantly, we need to look at those cows more specifically and more thoroughly. So it's just a glance will work probably with those sick cows after calving. It won't work before calving. So different example. For instance, this one. This is actually the ideal example I can give you, and you all have these types of cows. This is the perfect cow that we want to have. Well, of course, we don't want to have a transition alert. We all want to have healthy cows, but if we have a transition alert, we want to see something like this. So this is a average cow in the dry period. She is around up and maybe a little under average, group average. But for some reason, she drops in her eating and rumination time. She gets this transition alert. She was treated symptomatically. I'll explain more in a bit. She got back on track again within a day, but more importantly, she was on top of her class after calving. And that's what we want to strive for, and that's also the way we want to use our transition alerts in preventing diseases after calving and ensuring a quick lift off in milk production after calving. And this one will have her first heat, also often referred to as silent heat, within the first 3 weeks after calving as well. These are the higher producing cows, but you can see you don't need a glass bowl to predict the future to see what happens with a cow that is on or above average. And I'll show you another example in a minute. So this was a intervention which was symptomatically, and that led to a immediate bounce back of this cow, which led to a well-performing cow after calving. But if you look at the next one, so 2 examples. This is a cow I was talking about earlier. You don't need that glass bowl to predict the future. If a cow is up or above average and she follows through until the day of calving, you know that the odds of getting transition diseases for such a cow are very, very, very low. So this one is on top of her class before calving. She needs to deliver the calf. That's why the drop, and then she immediately continues what she was doing a day before. Those are the most ideal cows, and again, a bit black and white, but all over the world, some are using this as well to, for instance, to select cows, because eventually, if you want to improve on a herd level over the years, if you select these cows, you also select on higher milk production and also on less transition disease. It's of course not the way you want to use it continuously, and obviously not at the moment you start with such a program, because you can also, just like I showed you in the last slide, you can also get those cows back on track again yourselves with sometimes some minor interventions, some right pushes in the right direction. But this is also an opportunity to use the system in another way. Whereas on the right, you can see that nothing happened with a cow that had some issues already from day 35, 36 before calving. She had an abomasal displacement to the right on day 9 after calving, which was surgically corrected, but you can see that she's still struggling afterwards, which just means that her primary issue wasn't fixed. And now we get back to the first part where I said the symptomatic treatment of that previous cow. They tried in this one as well. So they gave her a painkiller on this day, they gave her a painkiller on this day and on this day, and you could see that this cow had some benefits of that painkiller, but because the primary cause wasn't fixed, she fell back towards her old habits, which was struggling. And that created some issues, extra issues after calving, the abomasal displacement to the right here on day 9, but she kept on struggling. And whereas in the previous one, we could see that such a treatment like this, even though it's symptomatic, can result in an immediate bounce back if we just follow up an immediate bounce back of a cow in doing what she would have done without an issue, causing her to perform at her best after calving. So that could have been the case in such a cow here on the right as well, if we would have a proper intervention on the moment that that transition alert was generated the first time. So long story short, what happens with these cows, and why are these cows that get these transition alerts, why do they eat and secondary ruminate less before calving? The reason for that is because they are already in a state of inflammation. They already have an inflammatory response, and we now know from literature that cows are actually quite similar to humans. So when you don't feel well or when you're sick as a human being, you don't decide to eat less, you just don't feel like eating. And that's what happens in these cows as well. They don't decide to eat less because it's, well, not that smart to eat less, especially not in this period, because it will lead to higher risk of transition disease. But they just don't feel like eating as much as they would without this inflammatory response. So how does that happen? There is a inflammatory response for whatever reason. I'll give some examples. But those during such a response, these inflammatory mediators, they are being released. They go through the cow's body, through the bloodstream systemically, and they reach the hunger center in the brain. Same goes for humans or other mammals. And they suppress the hunger center in the brain. And that's why you don't feel like eating as much as you would have been eating when you would not be in that situation. And that happens with these cows as well. So they just don't feel like eating, and that's being caused by those inflammatory mediators that are going through that cow's body. So where are those inflammatory mediators come from? That's actually, that has 3 major reasons. The first one, that probably won't sound as a surprise, the first one is an inflammation. For instance, a mastitis in the dry period is one of the most missed diagnoses in the field. Furthermore, we know that over 80% of all mastitis cases in the first 60 days after calving originate from the dry period. So maybe on your specific farm, a lot of these cows with a transition alert already have a mastitis. Diagnosing a clinical mastitis when they're in lactation is not that difficult. Diagnosing a subclinical mastitis when they're in lactation is a bit more difficult, but still we've got the tools. It gets really difficult to to diagnose a clinical mastitis in the dry period is also not that difficult, because you would see the udder would be painful, the udder would be swollen, it's probably red. She probably tries to kick the light out of your eyes at the moment you touch it, so that's still doable. But a subclinical mastitis, to diagnose that in the dry period, I wouldn't know how to do so. Of course, there are some options to define certain risk factors. So, for instance, the somatic cell count at dry off, her previous mastitis history, especially last lactation, what happens on herd level from dry off in the dry period, and then towards the lactational period at on a somatic cell count level. There are options, there are risk factors to be determined per farm, but still it's very difficult to diagnose subclinical mastitis in the dry period on an individual cow level. But it is a mastitis. It causes inflammation. It causes those inflammatory mediators to have a negative influence on the hunger center in the brain, and it leads to less eating time in dairy cows. But also think of something also that sounds. I mean, everyone knows that, for instance, digital dermatitis is a huge issue in the dairy industry these days. But to really understand that digital, especially the M2 type lesion, so the active lesion of a digital dermatitis case in the dry period, can lead to that systemic inflammatory response that suppresses the hunger center in the brain, that leads to less feed intake. So also the prevention of digital dermatitis or also interdigital dermatitis, especially in the dry period, is very, very, very important. And I cannot state enough how important actually lameness in its entirety is, especially related to transition disease, but more after this slide. So that's the first reason, in inflammation. Second reason is pain, and not pain as I'm a cow, I bumped into another cow and she kicked me and now I decide to eat less for 50 days in a row. It's chronic pain. And that's also known from human medicine. People with chronic pain are more susceptible for other diseases. Same goes for cows. And the number one reason for chronic pain in a dairy cow is chronic lameness. And especially those mildly lame cows we tend to miss, because everyone sees that cow walking on three legs. But what happened before? And how much time did she need to walk on three legs? And was she already lame, let's say 2 months ago or even more? So lameness is especially the number one reason for chronic pain. It leads to that same inflammatory response even without an infection, and that leads to less feed intake in the dry period, and that leads to a higher risk of transition diseases. Third reason is chronic stress. Again, also known from human medicine, chronic stress. People with chronic stress are more susceptible for other diseases. They don't go to the office as much as the healthy ones or the ones without stress. And that's the same for cows. So cows with chronic stress, if they had the choice, they wouldn't go to the office as much as the healthy group mates, and that leads to that same inflammatory response after a while, and that leads to less feed intake. So think of high stocking density, so overstocking. Think of long-term heat stress, especially in the dry period. It's very important to prevent heat stress, especially in the dry period. Think of the hierarchical issues, especially for the lower rank animals. If you have continuous pen moves of individual cows, but let's say you have two groups, Group A and Group B, and there is almost a daily or a weekly pen move from cows from Group A to Group B. Those lower rank animals in Group B, also in Group A, but that's a different discussion. Those lower rank animals have continuous hierarchical fights to determine their position within the group, especially when higher rank animals are being introduced. So those lower rank animals in the group, they're being bullied, they're being chased, they're being pushed away from the feed or their cubicle or whatever where they want to lie down. And those animals, especially on the long term, are more susceptible to develop diseases. And it also induces that same inflammatory response. So chronic stress is also really important from a cow's perspective. So hierarchical issues, prevent hierarchical issues. It always pays off to create a separate heifer group. So premium pairs like cows here after calving in a separate group, but also in a separate group before calving always pays off, because those are the little ones, and they just don't stand a chance towards the big mamas that already had 4 calves here in this period. So those 3 issues are the 3 issues that are causing that inflammatory response, leading to less feed intake already before calving, and that induces transition diseases after calving. And that also clarifies why, even though you have for instance, a solid negative DCAT ration in the dry period, it still explains why on those farms there are still cows with even with clinical hypocalcemia. So about that lameness, I just wanted to show you this slide. A study done from the UK already in 2016. Here on the left, you can see a CT scan from a healthy cow's foot. And so this gray part is the hoof horn. That's what we trim, especially this part, of course. And this is the bone, the pedal bone, and the pedal bone, the surface underneath here of this pedal bone is very smooth. And that's how that bone should be. Whereas if we go to the right, we see these bone spikes occurring. And that's what we don't want to see, because this process is irreversible. And no matter how good we are in hoof trimming, when we trim the nail, the horn, and that doesn't affect the bone. Well, in a negative way it does if you do it in the wrong way, but you cannot, by trimming the horn, you cannot intervene in this anymore. So this is a lost case, a lost cow. And those bone spikes, those are called exostosis, and those are formed by a deviation in weight bearing. So when a cow starts to walk lame, she tries to relieve the weight bearing of that part that hurts, increasing the pressure on the other side, and that could result in a deviation of the pressure of the hoof, leading to those bone cells to form new horn, and that will lead to something like this. Unfortunately, we don't have X-ray eyes, and also even the best hoof trimmers don't have X-ray eyes, so we cannot see what's happening. The thing we just need to know and recognize is that when we see a mildly lame cow, these exostosis, these bone spikes, they can already start growing from 4 to 6 weeks of a mildly lame case. So, for instance, when we trim before dry off, which is advisable, and for some reason a cow gets lame in the dry period, still a lot of people say we don't want to touch her in the dry period, because that could lead to stress, that could lead to abortion, and we want to prevent that. True, but we also want to have milk from this cow, and we want to have another calf from this cow. Plus, we can also do something about the stressful situation and the handling of a cow during hoof trimming. And I think, and that would also be my advice, and it's also confirmed by recent literature, that those lame cows in the dry period, you need to address those as soon as possible, because those, first of all, those are your cows that will have transition diseases after calving, but those are also the cows that will develop these exostosis during the dry period, during a period of, let's say, 4 to 6 weeks, and then you're done. You can't do anything about these anymore. And that's also one of the conclusions from this research, is that the data they had from all these cows, it really showed that our um, um, perspective is that if we trim a cow with this, which we cannot see, but when we trim a chronically lame cow and we see a lesion, let's say a sole ulcer or a white line defect in such a hoof, we put the other hoof, we put it on a block. We can see that she walks better after a while, and uh, um, of course a painkiller will help. But when the block wears off, she's, from a cow's perspective, she's still lame. From our perspective, she's lame again. So our conclusion could be new case of lameness, where from the cow's perspective, it's the same case of lameness because of this bone deformation creating to a high pressure point, especially on this spot. And you can also see that thin line here, creating a dent in the horn. And that's also the same spot where we see all those sole bleeding and sole ulceration. And those are being caused by those bone spikes. So it's very important to also trim lame cows, especially when they're still in a mild lame situation, also during the dry period. So it's probably too small for you, but it's not really about the images. It's really about the entire story. I told you at the beginning, we've got 3 modules: fertility, health, and nutrition. Fertility and health show you what's going on, and nutrition shows you why it's happening. And this is actually the perfect combination of all those modules, and that's how it works in real life. With just the fertility module or just the health module, you can already improve a lot. But when a cow gets sick, especially if you look at the numbers, so most of those sick cows are transition disease cows, there's also an option to be able to prevent. And especially when you extend that transition period, so we're not now, from now on, we're not only looking at the first 30 days after calving, we're extending that period until cows get pregnant or until peak milk production. And what we see, if you play around, you can also add and delete columns if you want to. If you play around with the system, you can see that when you put in the fertility insights column, select no heat after calving, then 9 out of 10 times those are cows which already had a transition alert before calving, which was calculated already from 50 days before calving. So it's not only, those transition alerts are not only pinpointing those cows that will get sick after calving, it extends the period, extends also the importance of a transition alert, which shows the effect on fertility as well. And unfortunately, we're not able yet to also include milk production in there, but those results will be the same. And if you look at the data we've already studied, it shows exactly the same thing for milk production. Those with the transition alerts, those are not only the ones that get sick after calving, not just the ones that have some bad fertility results, but also are disappointing in their milk production. So again, those transition alert cows, if you look at them the way we look at transition diseases after calving, you won't see anything on those cows because it's much more subtle. We need to look in a different way towards those cows in the dry period, towards those cows with transition diseases, transition alerts, sorry. We need to be more critical, and then we're able to get those cows through the transition period in a good way. And that, to summarize, starts with exclude lameness, exclude inflammation, so mastitis or digital dermatitis or interdigital dermatitis. If we can diagnose one of those, we need to treat accordingly. If we cannot exclude those things, we still know one thing for sure. She has, for whatever reason, so could be chronic stress, could be chronic pain, could be chronic something else. She has this inflammatory response, and we can do something about that. We can give her a painkiller, a non-steroidal anti-inflammatory, like a meloxicam, for instance, or a ketofen. We can do something else as well, and we need to do that all together. We also know from a basic cow behavioral point of view is that cows drink first before they eat. And that's how cows balance their ruminal contents on a daily basis, so that rumen also helps, and we can trick the rumen, and therefore we can trick the cow by pumping lukewarm water, let's say 50 liters of lukewarm water in the rumen, because the rumen is continuously monitoring the balance between fluids and dry matter. That's why she drinks first and then eats. So she drinks, cows drink a lot, over 150 liters a day. And when it's warm, even more, they go up to 200 or even more. And especially those high producing cows, they drink more as well. So they drink quickly and a lot. And then they need to eat because they need to balance the rumen again. When a cow doesn't eat, she probably drinks less or won't even drink at all as well. So we can trick her by pumping her 50, 60 liters of lukewarm water in there. And then something else that could also be beneficial, but more focused on the microbiome of the rumen. That's by, for instance, adding live yeast or live yeast boluses or live yeast caps in there as well. Be careful you don't use the ones with the added calcium too. Those are for after calving, but just the ones with live yeast. They have the same effect as like a Keckstone bolus, but they contain antibiotics, or I should say stuff with antimicrobial activity, but it's monensin, so it's just an antibiotic, but it's not registered that way. But that's also, yeah, just a small bandage to cover up the primary cause. So still, primary cause, figuring that out is number one, and then we can look at the symptomatic treatment. And if you use those, then we already have some very nice examples of farms that are implementing these interventions, and they book results quite quickly. And at the end, I'll show you a return on investment calculation, and I can also show you what happens on these farms. So there's a question. I wondered if lameness will show up as a transition alert or only as a health alert. That really depends on that. That's a good question. I'll extend the question a bit because some people also ask if the transition alert is replacing the health alert in the dry period. It's not. So it's not when a cow really gets sick in the dry period, she still gets a health alert. But those transition alert cows are cows, so it focuses on the cows that are underperforming. So they're not sick yet. They will be after calving. They're not sick yet, but they're underperforming. A cow is, and that's for lameness also really important to mention, a cow is an animal of flight. It's a herd animal. It's an animal of prey. And that means that a cow is programmed not to show anything at all, and that's why it's very difficult to detect those issues already before calving, but you can do so by monitoring her 24/7, and that's what the sensor does. So what does lameness do? Is it a transition alert or is it a health alert? That depends per cow, because that depends on how bad the lameness is. So if you look at the mobility score, score 0, 1, 2, 3, or locomotion score 1, 2, 3, 4, 5. If they go immediately from healthy to severely lame, that will probably be a health alert. But in most cases of lameness, there's a gradual deterioration, and that will, in most cases, show up as a transition alert first. And depending on the speed of the deterioration, it could result in a health alert afterwards as well, also in the dry period. But most of those, especially in those mildly lame cases with a not so fast deterioration, those will be transition alerts. So pumping Holstein cows 50 to 60 liters is a recommendation literature of Jersey cows. Yes, good question. I would recommend to go up to, let's say, 40 liters max for a Jersey cow. Because just like you say, those are smaller. Those are also more susceptible. So especially in Jersey cows, these transition alerts are very important because Jersey cows, they have much less vitamin D receptors, which means that they are much more susceptible of hypocalcemia. And that results in more transition disease. So even, especially in Jerseys, these transition alerts are even more important to figure out what's going on, because Jerseys are eventually more susceptible of transition diseases. So I'll continue quickly because talking about transition is one of the things I like to do most, and that also takes up most of my time. Here you can see one of the examples of not only on an individual cow, but also on a group level, what a pen move does. So normally these cows are being transferred from far off to close up at day 25 before calving. That's what you can see in that brown line. So there's a huge drop of eating and rumination time on a group level. So they go from 14 hours a day towards less than 10 in a period of, let's say, little over 3 weeks. And that's a drop of over 4 hours on a group level, on a herd level, and that's way too much. That's completely unnecessary. And that's us as humans inducing not only transition alerts, but also inducing transition diseases after calving. More of that later. And you can see what happens with this individual cow. So she was a bit late. She was transferred at day 17 before calving, but she was a little under average in eating and rumination. But due to the pen move, poof, she dropped in her eating and rumination. So that's also an important part. So to summarize, transition management, and to make the step right now from individual cow monitoring and treatment towards improving your herd management regarding transition. We've got 3 moments to really intervene and improve transition management, and it already starts around dry off. This is a graph which is something that you don't want to see on your farm. This vertical line is the moment of dry off. There is also the second one is the pen move from far off to close up. I just addressed this graph. This is also something you don't want to see, not in an individual cow case, but also not on a group level. And then there is obviously the moment of calving, which gives us also an opportunity to improve a lot of things that we can do and that we have control of. So for instance, when you see this intersection of yellow and blue, yellow is inactivity and blue is rumination, that happens here on day 15, day 16 after calving. That's also something we don't want to see. So I'll give some more examples of those. And that's the connection I talked about at the beginning, where we make that connection between those transition alerts from the individual cow towards herd management, which is in this nutrition module in the behavior around event, and that already starts at dry off. So I'll go a bit more quickly right now because this is a bit more easy to understand after all the previous I already mentioned. On the left, a farm, perfect example, we don't want to see any negative effect on group behavior. So now we're looking at group graphs on herd graphs, farm graphs, no negative effect of dry off on behavior. So blue is rumination, yellow inactivity, and green is eating. Of course, we have more behavioral parameters, activity, high activity. You can also choose for eating and rumination. I always start with these three because they already give me most important information. And when in doubt, I also use activity and high activity, for instance. I like to, in these graphs especially, I like to split eating and rumination. Some use them together. I just like them separate. And this is something you want to see. So this on the left, perfect example. On the right, not so perfect example, or a perfect example of what we not want to see. So of course, we can say a lot about the preparation of the moment of dry off over here, but it's especially those first 7 days and even a bit longer, especially to be honest. But those first 7 days after dry off, this is a huge stress event on a herd level, 2,000 cow dairy. So almost all cows are affected. So what did they do on this farm? They milked cows here in late lactation 3 times a day. They were dried off at, well, very bluntly, so no preparation, just dried off. Still producing too much. They were vaccinated with a all type of vaccine, which is painful but also induces inflammation. They were hoof trimmed at the same day, and they were put on transport towards where the dry cow barn was located, and that was not very close. And they came into a group with high stocking density. You can see that there's a huge stress event in the first 7 days, but especially if you look at eating time, it takes them up to 3 weeks after dry off to reach a stable level and to reach the same level as they were on before dry off, where normally, and of course there are some exceptions, but what you normally would see is that eating time in lactation is a bit lower than in the dry period, and that's why you cannot compare eating times with dry cows and compare them with lactational cows, because it's a different ration. And when you, of course, eating time is correlated to dry matter intake, but you need to be honest in that case. So you need to look at those between groups, also between parity groups, and then you can compare within those groups, but not between those groups, if that sounds logical. So, and here it takes 3 weeks to reach the same level as before dry off, where normally in the dry period you would see a little bit higher eating time. So, second moment is the moment around calving. And here on the left, again, perfect example of what we want to see. That intersection occurs on day 2, day 3, here on day 3. And we see that on those farms, they will have less transition disease, because remember what I mentioned earlier, cows, even though especially when the dry period is managed perfectly, they can still get sick after calving. Those cows won't show deviation of behavior already before calving, but we can still screw up after calving, and that's what happens on this farm. And that leads to more transition diseases after calving, even though not all of those were flagged already before calving. And again, also before calving, a lot to say about these graphs, but especially focus on that intersection here on day 15. We can do a lot about that, especially stocking density, pen moves, having some pre-fresh and pre-fresh groups to from a good point of view, from a good reasoning, to help them or give them more opportunity to let them recover. But again, every extra pen move is also extra stress. And that's what we won't want, because we don't want to induce chronic stress. So also an opportunity is the group overview. You can, even if you use the system for 10 years, you can look back in the system for 10 years and you can compare 10 years. There's no limit on how many years you can look back. So you can always look at, okay, what happens this year? Is that the same pattern that happened last year or the year before or 10 years ago? Also look at improvements. And if you put in ration changes, for instance, you can immediately see, so especially this last ration change, you can immediately see an incline of almost an hour of eating time after this last ration change. Some ration changes also won't lead to behavioral changes on a herd level, but it could lead to higher or lower milk production. So it's not always determined by changes in behavior, and not all ration changes explicitly need to have a change in behavior, but some do. So it's always very important to look at what happens after any type of change you've made on a group level. So for instance, what this farm did is they had multiple ration tweaks, so weren't really changes, but more tweaks, because they knew that they're using the system already for a longer period of time. They knew that they had the best performance when eating time was around 4 hours and rumination time was around 8 hours. And that's what you learn if you really look at these graphs thoroughly, and also get the help of your veterinarian and nutritionist to to tweak the ration in a way that you are performing at best. But again, not every ration change necessarily leads to a change in behavior. And you can also use the transition comparison or dry off comparison between years or between groups. So for instance, here was a farm which had some issues after calving. They had that intersection of both of those behavioral parameters at day 8. They made some changes, especially in a dry period, but they made some changes after calving as well. So a year later, they were on day 3. And on this farm, that has led to 20% less transition diseases after calving on a herd level. And that's not only increasing animal welfare, but that's also increasing efficiency and milk production. So very short in these last minutes, there are 4 types of group alerts in this nutrition module: heat stress, feed intake, group stress, group health. Very quickly, heat stress. Heat stress, we're not pretending that this heat stress alert will lead to less heat stress, because when this alert is there, they already have heat stress, although in an early stage, of course, because we flag those groups in an early stage of heat stress, but there is already heat stress. So it's more to raise the awareness of heat stress, and you can compare groups if you have more groups, but you can also compare years, and then you can really say, if you go to the legend in the web application, go to reports, and then group health history, focus on heat stress, and then you can see which groups had more heat stress this year compared to last year, for instance. So it helps you making that decision for, let's say, for instance, group 21 we need to do more in our heat abatement strategy, because that's the group that is most affected by heat stress. So heat stress, how does it look like? This black line is the air temperature, because we don't only monitor behavior, also air temperature. So temperature goes up, rumination, blue one, goes down, eating, green one, goes down, and orange, activity, goes up. And in that combination, on a herd level, heat stress alerts are being generated. Second, and this is actually why it's called the nutrition module. It's not about the percentage of crude protein in the ration, and it really doesn't matter if that's on 14 or 15%, or if the percentage or grams of magnesium is, let's say, 6 or 6.1 gram per kilogram. That really doesn't matter. Of course, it's important, but it's not as important as feeding your cows the right stuff at the right time. So of course you need to analyze your ration, you need to have a solid ration calculation, but then you can have the most perfect ration on paper. If the cows won't eat it or they won't get it in time, then you lose a lot of milk production, and that's losing a lot of money and inducing more susceptibility of disease. So if you look at the report, so group alert history and then feed intake, you can see that on farms with, especially the red ones, low feed intake alerts, 9 out of 10 times every day, or more or less every day, it's the same group all over again. And how does that look like? Well, sort of like this. So for instance, this plateau phase here, something we don't want to see. But don't focus too much on just one behavior. Always use at least two behaviors at the same time. So for instance, we switch over here, we switch from daily towards hourly in the group overview. And here you can see perfectly the circadian pattern, the diurnal pattern, so the day and night rhythm of cows. And that's for a part, in a way, they are programmed to function, but also in a way they are being influenced by us. So we can help them in being and acting like they are natural animals, cows, and we need to help them with that, because they cannot, like they would do in nature, they cannot look for the feed themselves. Well, they can just walk to the headlocks, but if there's nothing there at the moment they want to eat, they go back. And then we can feed them later, and they try to compensate, but they won't eat as much as they would have been eating at the moment when they were fed at the right time. Again, here's a perfect example what you want to see and how cows function in the system where we keep cows. So at the end of the night, at the beginning of the morning, just before dawn, cows stop ruminating on a group level. So at the moment rumination drops, there needs to be fresh feed available. That's the moment where cows eat the most, early morning. And you can also see, especially in the higher producing barns, that's why there's this small circle. So believe me, well, the people with good eyes will be able to see, but the 7 minutes per hour is a sort of lower, is a perfect lower value. So it doesn't mean that they won't eat anything at night, because they're being kept in a high producing environment. They also need to, a lot of those cows, especially peak lactation, still need to eat a meal or two at night. That's why it won't go to zero on a herd level. But when it does, you will have some issues. So if you look at the next one, so this was the proper one, the left one. This is the perfect example, which we actually want to strive for every group, especially the dry cow group. And this is something we really don't like to see. So what happens? They drop, so here it's 0 minutes per hour. So they nearly drop to 0 minutes per hour at night. At the moment, so early morning, they drop with rumination, and then it takes 1, 2, 3, 4, let's say 5 hours in this one, and on this one it was 6 hours on top of my head, where they really start eating on a group level. So that's the moment of first feeding, and that's in this group the only moment of feeding, because there were 2 push-ups. And you can see that there's a huge compensation peak, and here also a huge compensation peak in eating time. But remember what I said earlier. Eating time is associated with dry matter intake within the group. So you cannot compare between farm A and farm B, or location A and location B. But within the group, it's highly related to the dry matter intake. If you would add up these minutes per hour per 24 hours, and you could compare it with, let's say this is the same group on the same farm where they're being fed on the right time, these, even though they try to compensate, they won't eat as much per 24 hours as they would have been eating if they were fed at the right time, which would happen in this left scenario. So the moment of feeding actually determines milk production much, and ruminal filling as well, much more, and also disease incidence much more than we thought it would. So it's really important. And of course, questions we get is, do I need to feed them at, let's say, in the summer at around 4 a.m.? Well, yes. And that's very easy for me to say from behind my laptop, and you don't have my address, so I'll be safe. But there's another option. You can also feed them the evening before, but with a proper amount so that there is still enough to eat, especially when it's still fresh early morning, that there's still enough to eat at or around dawn. So it, I just cannot stress out enough how important feeding at the right time is. And then, of course, afterwards we can talk about rational composition, rational analysis, and whatsoever. So what percentage of dry matter is taken in the AM compared to the PM? That's a good question. That's also depending on the amount of push-ups during the day, of course, and if there's a secondary fresh feeding during the day or not. But normally, especially in such a case like left scenario, over 50% is taken up in the AM part, and then less than 50. So let's say up to 60 in the AM part, and then 40 in the PM part. I think that's about close to what happens in real life. Yeah, I think that would be a proper answer. Of course, there are some differences, especially when they need to compensate. So if they are not being fed enough in the AM part, they need to, and they will try to compensate in the PM part, but in the 100% 24-hour part, it will be less. So last two types of group alerts. So here on the left, also hourly pattern here, group stress alert. So what happened on this farm was a Dutch farm. At night, he had a group stress alert, and in a dry cow group, and he never had a group stress alert before. And he was already lying in his bed. So he got up, went to the dry cow barn, opened the doors, and was there eye to eye with a wolf. So that wolf chased the cows a bit, and also scared the farmer, but he didn't wear a sensor. But it led to a group stress. So for instance, what else could lead to group stress alert is, for instance, when you have pasture access and a jet plane flies over, or a helicopter flies over, or a hot air balloon lands in the field. Those are the things that could lead to, are the most common examples we see in group stress. Could also see sometimes a group stress alert when there is actually no feed, and it takes a while before there is new feeding, fresh feeding. So that could also lead to group stress. So you have a low feed intake alert first, and then afterwards a group stress alert. Group health alert could be, of course, an outbreak of some examples I've seen lately is a bovine herpes virus outbreak. And in this case, it was a deliverance of a wrong type of concentrates, leading to a group health alert that was switched back immediately 1 or 2 days later, and then they were back on track again. So these are mostly focused on the outbreaks of diseases and or really in the nutritional errors. So it's in dollars because this return on investment calculation is based on scientific publications, and those are mostly focused on US data, and to really show what's happening. So if you have 1,000 cow dairy, you can also use a 100 cow dairy and just remove a 0. If you have an average of 37% of transition diseases, which is, I think, an underestimation, you have already a complete return on investment of the entire nutrition module, solely based on the use of the transition alerts. If you're able to, on 1,000 cow dairy with 370 cows with transition diseases, if you're able to prevent 30 of those, so on a 100 cow dairy, 3 of those, you'll already have a complete return on investment. And those are just the transition alerts, and I hope you've seen that you can do so much more with this module. You don't have to do this alone. You don't have to do this all by yourself. There's also a functionality we call multi-view. It's free of charge. It's not related to the nutrition module, but it's most of use with the nutrition module. You can give access towards everyone you want to have access to the CowManager system. They don't have to pay, you don't have to pay extra. It's also, if you just have the fertility module, it's there. You decide who you give access to. It's very simple. Go to multi-view, click on add user, fill in the email address, click on save, and they will get an email to create an account and a password, and then they have access to the things you give them access to. And then they can help you, for instance, a veterinarian or a nutritionist, they can help you with also with remote counseling, but also in preparing the herd visit. So for instance, for a vet, I would have loved to have such a functionality in when I was working in practice. For instance, I want to have a work list with all cows with a no heat after calving flag, or I want to look at all the cows that had a transition disease since last time, or a health alert, or whatsoever. So those people are able to get all those cows with just a few mouse clicks, get all those cows out of the system. And that's actually what I wanted to show you about our nutrition module. I hope it was all clear, and I would like to give the word to Ben to maybe have some additional questions or to close this session.
Thank you, Peter. Currently, we've got no more questions come up in the chat, but if anyone has, then feel free to quickly add it in. It's been a fascinating insight to the module, and actually, there's so much more in it that you can get with a little bit of training, a little bit of an insight. So, thank you very much. For those of you already using the module, then hopefully that's given some decent training. For those of you that haven't, you will see down the bottom of your dashboard that your nutrition and transition alerts are grayed out. There's a button on there to click, and it will enable a free trial of the module, and it will also notify Krista and myself, so we can get in touch with you and do a bit more further training when you first start up. If anybody comes off the back of the webinar and suddenly thinks of more questions, feel free to reach out to Christo, myself, either via the phone, email, send us a WhatsApp, and we'll endeavour to get some answers back to you as soon as we can. But we have no more further questions. So unless anybody has got anything else to add, then thank you very much for your time. Nope, we are there. Perfect. Thank you, Peter. And
thank you, Ben.
We'll catch up again. Take care.
Thank you. Bye-bye.
Bye-bye.